Sleep apnea is a very common and actually interesting disorder that can affect both children and adults, and kind of very different diseases in both cases. In children, it's classic. The mom comes in, my child stops breathing, and then gasps. And so then we talk about that. In adults, most of them will snore, and then maybe their wife or husband will say they stop breathing. It can have a lot of serious consequences, particularly for the heart and cardiovascular system. One of the interesting things about sleep apnea is you can actually have this disease, have significant symptoms and problems from this disease, and not even know it. People will complain of various symptoms. I am tired all the time. I'm falling asleep while I'm watching TV shows I like, or I wake up with a headache in the morning. Snoring does not always mean you have sleep apnea. Frequently with children, children will snore and not have sleep apnea. In adults, about 50%, so it's a coin toss if you have sleep apnea when you snore or not. It is certainly a symptom to discuss and may trigger further investigation. The gold standard of diagnosis for sleep apnea would be a sleep study. And that's really what needs to be done so that then you can move towards treatment, which would be normally CPAP first, sometimes surgery. So the CPAP machine causes a constant pressure. So it's using a column of air to hold open your airway so it's not closing up, causing the apnea. The airflow is constant. It takes a little getting used to. Some of our colleagues actually will be in charge of prescribing that and following up on that. There is a subsegment of patients who you look at their anatomy and they're actually good surgical candidates, and sometimes surgery can be very helpful. You just have to very carefully select out those patients. One of the advantages of seeing an ENT is our expertise in the head and neck anatomy, from the nose, which is important for airflow as part of potentially the treatment for CPAP, and also can just be a problem in and of itself, to looking at the throat, looking at the tonsils and seeing, is this a surgical candidate, and advising them as to what those options could entail. In adults, the danger of prolonged sleep apnea without treatment is potentially right-sided heart failure and a cardiovascular event, and arrhythmia, and death. My advice on sleep apnea is, if you have concerns, I think it's worth looking into for your child or for another loved one. This is not just an annoyance, it's not just loud snoring, it can have very real health consequences. In sleep apnea, actually, there's many things on the horizon. It's a difficult problem and a difficult one to treat, and a lot of patients truly hate the CPAP. One of my colleagues, Dr. Franklin, is involved in a cutting-edge study where they're stimulating the nerves to move the tongue so that the airway stays open during sleep to avoid the sleep apnea. It's fairly fascinating.